Hi Burn Boot Campers, my name is Amanda. I'm a physical therapist at Streamline Physio in Verona. We do things a little bit differently here, getting you back to 100% with anything you have going on without the regular limitations of insurance or the typical medical system. I'm a pelvic floor physical therapist, and today I'm going to show you what your pelvic floor is, what your pelvic floor does for functions, and what you could come to physical therapy for to help with symptoms related to your pelvic floor. So I'm going to show you the pelvis first. This is low back. This would be where organs would sit, and then hips here, or hip bones. If I face it this way, all red is muscle. So everyone's external pelvic floor looks a little different, and I'm going to take that off. The rest of this red here, this pelvic bowl, looks the same on every body. Now, the functions of the pelvic floor are bowel, bladder, and sexual functions, along with organ function, breathing, and stability. And I work a lot with breathing and stability of the pelvic floor because pelvic floor is part of your core. So it's not just your abdominal muscles. And then breathing is how your body deals with pressure and stress in the body. So if your pelvic floor is not functioning with your core, or it's not responding to how you're breathing, there can be this increased pressure or lack of pressure or mismatch that is causing some symptoms. And those are what we spend a lot of time on in therapy. What this looks like, or what you would come into therapy saying your symptoms are, would be things like constipation, any incontinence, meaning urinary incontinence, anal incontinence, which is farting, or fecal incontinence. Urinary urgency, so feeling like you have to pee all day long or all of the time, even if your bladder isn't full. Any pelvic or abdominal pain or pressure along the lines of endometriosis or not. Any pain with penetration or insertion. Anything in the life cycle of pregnancy, labor and delivery, and postpartum. And then a tricky one is if you're someone that is dealing with chronic low back pain or chronic hip pain, it could be related to how the pelvic floor is functioning or not functioning with your core or your breathing, your stability, and things like that. So that's usually one that's missed by other therapists if they are not trained in how to check how the pelvic floor is functioning. So if any of those symptoms sound like you, or you have any more questions about pelvic floor physical therapy, please feel free to reach out to me. I have cards at the gym, my email's on there, or get on the phone and book a discovery call, and we can see if physical therapy is a good fit for you. Let me know if you have any questions, but good to see you all, and we'll talk soon. Bye.